Welcome to the Mental Health Merienda, your snack size guide for mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker. So for today, we're going to explore bipolar disorder. We wanted to give more people information about different mental health conditions and also provide information about treatment. So we already have videos on anxiety, depression, OCD, and ADHD. So we're just adding bipolar to that library of resources.
So, bipolar disorder is another popular diagnosis that people might hear about in the media. And there's actually quite a few celebrities who have shared that they have the diagnosis. There's Mariah Carey, Demi Lovato, Catherine Zeta Jones. And actually, Selena Gomez was praised recently for her honesty about her struggles with bipolar disorder in her documentary, My Mind and Me.
Unfortunately, there are still a lot of stigma about bipolar disorder and a lot of misconceptions also in the media. So sometimes TV shows and movies will portray someone with this diagnosis as being really scary, maybe even really violent. And that's just not the case. It's great that, certain celebrities are coming out and being very forthcoming. So that it shows you that, not everyone looks like scary and violent. But again, we still have a lot of misconceptions in the media. So Adeline, what is bipolar disorder?
Bipolar disorder, it was formerly known as manic depressive disorder, and it's a mental health condition that causes extreme mood swings. So those include emotional highs, which are referred to as mania or hypomania, and we'll explain those in a couple of minutes, and the lows, which are depression. And although bipolar disorder, it could occur at almost any age. Typically, it's diagnosed in the teenage years or early 20s, and symptoms can really vary from person to person, and they may also vary quite a bit over time.
Yeah. So let's start off with talking about the depressed episode. So in that depressed episode, you may feel sad, you may feel hopeless. We kind of touched upon some of these things in our video about depression. A big part is also losing interest or pleasure in the activities that you normally like to do. You may also experience changes in your sleep patterns and in your appetite, and then having suicidal thoughts. And ideation is another big one. And when we're talking about mania or hypomania, and when we say hypomania, that's actually just a less extreme version of mania. With mania, there's these mood shifts. So a person might feel or seem like they have this inflated self-esteem, almost as if they're invincible. They could report feeling euphoric, so just really full of energy, almost like they just can't do anything wrong. They can do everything. To someone noticing it is very jarring. So when you're in this manic state or even hypomanic state, which again, hypomania is just a less extreme form of mania. But when you're in this manic state, you feel like you can do anything. You also have mood swings that can affect how you sleep, your energy levels, and then also your behavior. And because of this, it's really hard to think clearly. So you might often see someone who, again, they have high energy, they think they can do everything, but maybe some of the things that they're wanting to do is actually not good for them in the long run. It's, they're not thinking it clearly, and they're not practicing good judgment.
Yeah, and a lot of people can be really productive too during that time. So there's even some people who know that they have bipolar disorder, and obviously you should not do this, but sometimes people will even stop taking their medications because they say that, oh, I'm so productive when I'm in a manic state or hypomanic state. But the being productive like that, it's at the detriment of your health. If you're being really productive, but you're not sleeping for 2 or 3 days in a row, that's not good for you at all. And the chances are that whatever it is that you're doing, if you're writing or whatever it is that you're trying to be productive in, you're probably not doing it very well.
When you're feeling manic or hypomanic, I've heard people say it feels nice. It kind of feels like you feel invincible. You feel like you can do anything. So it's a nice feeling. So sometimes I've heard of clients just not want to take their medication because their medication takes that away. But it's at the detriment of their overall mental health when they make those decisions not to take their medication. So some symptoms of mania can include being abnormally upbeat, jumpy, or wired. So again, to someone seeing it, they don't seem like themselves. It is a little jarring to see. We mentioned this earlier, but that increased activity, increased energy, along with that might even be increased agitation. A decreased need for sleep is a big one. Wouldn't you say, Adeline, especially in your testing that you do?
Yeah, so I get a lot of referrals for patients who there's a question about whether they might have ADHD or just trying to help clarify their diagnosis. And this is a big question that I ask is, do you have, first, how many hours do you sleep per night? So, do you sometimes go to a few nights where you only sleep 2 or 3 hours or even fewer than that? And so if the person says yes, then my follow-up question, which is really important, is when you only sleep about 2 hours, how do you feel the next day? And if they say, I feel fine, that is a big, it's not diagnostic. It doesn't mean definitely you have bipolar disorder, but that's a big key because in most people, there's a lot of different mental health disorders that can cause you not to sleep as much. So ADHD, sometimes if you're more in a hyperactive state, or if you're taking like stimulant medication, that can affect your sleep. But if you don't sleep as much, you don't feel good. With bipolar disorder, you feel pretty good. So that's a big key.
Yeah. So that decreased need for sleep. So it's the need part. And then other symptoms could also include, again, going along with that, being wired and having this inflated self-esteem and high energy, talkativeness, like rapid speech. So think of someone who's just talking. They just want to get all the words out. They're not giving you a chance to jump in. There's no pause. So sometimes when people talk, there's like a natural pauses that happen in their cadence. But with this type of talkativeness, it's just like you're just rattling off, and you can't, as the other person,
even get a word in.
I can't get a word in. Exactly.
Mm-hmm.
So that's another key one. Racing thoughts, distractibility, which again, that's also common in ADHD. So that's a similar symptom that they share. A big one is also poor judgment. So again, they might be feeling like on top of the world and they're doing all these things, but the quality of what they're doing may not be great. Like you're talking about writing, right, Adeline? Like maybe they're writing all this stuff and they think it's like, oh, I'm getting so much done. But then when you like look at the quality of the writing, it's maybe not that great. But poor judgment is also like not thinking about consequences. So a big one might be, if someone's in a manic episode, they might, start spending a lot of money or gambling. And again, usually they would think like, oh, okay, I could only gamble, X amount. But the poor judgment would be like they're gambling like their entire like life savings. They're gambling things that they, the worth of their car or something like that. Something that's just like, in a normal state, you would think that that's just, you wouldn't even risk doing that behavior. So another one related to that is also increase in risk-taking behavior. So you're making these choices that are going to bite you in the behind in the future. So not good choices to make.
I think a lot of it is, we all have times that maybe, I overspent too much. I went out to dinner or I went out for drinks and I spent a little too much. This is so much more extreme than that. This is a regular pattern of spending so much money. And we're only using money as one example. There's many examples, but with using that as an example, you spent so much money that now you can't pay your rent. And this happens to you on a regular basis. You risk-taking behaviors, having multiple sexual partners and not using protection, for example. That's a big one where you're at risk of getting an STD. So it has to be this regular pattern of making these really poor decisions, increased risk-taking, and it's also showing poor judgment. So you're driving down the highway at 110 miles an hour. So, I'm not saying, 80 miles an hour, like 100 miles an hour. It's very, very extreme, because I think a lot of these symptoms, we all have them sometimes. And also if you're, a teenager, you're more likely to do these kind of things too. But it's a regular pattern of doing these extreme things that can be really, really risky and show poor judgment. And so the mood episodes, they can last for days, weeks, or even months. And so again, they might occur just a few times a year, or it might occur pretty rarely. And then when they do occur, they can last for days, weeks, or months. And they can significantly impact a person's ability to function in daily life. And that you'll hear us say that a lot in these videos addressing mental health disorders, that, I mentioned in the OCD video, some kind of maybe little OCD symptoms I might have. I don't have OCD. It does not impact my functioning, but that's a big key that you need to see in any of these disorders. For anyone who might question if they have them, or if a loved one has them, it has to really impact your functioning.
Yeah. So when we're talking about bipolar disorder, there are different types of bipolar disorder, and each of them have their own unique symptoms and patterns. So we'll start off with the first one, which is bipolar I disorder. So with bipolar I, there's at least one manic episode, and typically that episode lasts about 7 days. For most of the day, you're feeling, again, that elation, that inflated sense of you can do everything, kind of all the symptoms we mentioned earlier. And then that manic episode would be preceded by either a hypomanic episode, so maybe like a lesser version of mania, or a major depressive disorder. So again, you're seeing these cycles. You're seeing like an episode of depression, and then an episode of manic, and then an episode of depression, and then maybe an episode of hypomanic. But there's this very like distinct episodes that are occurring with bipolar I. And in a lot of cases, when it comes to the mania that's seen in bipolar I, Sometimes they may trigger psychosis, which means there's like a break from reality. So that's another key distinction between bipolar 1 and bipolar 2, which Adeline will get into.
And so with bipolar 2, it means that you've had at least one major depressive episode and at least one hypomanic episode, but you don't have manic episodes. And so, in other words, you can think of bipolar 1 as more of a overall mania. And like Michelle said, in those cases, you can sometimes have psychosis. Psychosis can mean seeing things aren't really there, having delusional thoughts, so thoughts that are not based in reality. So symptoms that to a lot of us might actually seem like schizophrenia, but they're actually related to bipolar 1 disorder. In bipolar 2, you don't have those, but you have a bit more of the depression. The manic episodes of bipolar 1, they can be severe and dangerous, but in individuals with bipolar 2 disorder, the depression lasts for longer periods. And so that can really cause significant impairment. So we're not trying to say that bipolar 2 is, it's not as big a deal. It's not as serious. You have more of the depression, which can really also affect your functioning day to day. And so the third type of bipolar disorder is called cyclothymic disorder or cyclothymia. And so in this case, it means that you've had at least 2 years of many periods of hypomanic symptoms and periods of depression, though they're less severe than what you would see in major depressive disorder. And just to mention, in children and teenagers who have cyclothymic, instead of being 2 years, it's 1 year, which actually Michelle will talk to us more about what we would expect to see in kids and teenagers.
So with children and teens, it's really rare to get diagnosed with bipolar disorder, and you can definitely see why. It's a very serious diagnosis, so a lot of professionals would probably, go towards another diagnosis before starting off with bipolar. Children as young as 5 and 6 have been diagnosed with bipolar disorder. It's been reported, but again, that is not the norm. It's extremely rare. So symptoms of bipolar disorder can be really difficult to identify in children and teens because it's hard to tell whether those ups and downs, those mood shifts, is that truly bipolar disorder or is that puberty? Is that just
or normal teenage behavior?
Teenage behavior. And I have a preteen, so I know it's not bipolar, but there are ups and downs with her mood, and that's that's normal, it's age appropriate. So again, it's really hard to tell whether is it just regular childhood or is it bipolar disorder. For children and teens who may have bipolar disorder, you will see that they do have those manic and depressive episodes like adults do, but the episodes are not as distinct as you would see like in bipolar 1 for an adult. So it kind of shifts a little bit more so in children and teens. But some prominent signs of bipolar disorder in children and teenagers may include, again, very severe mood swings that are outside of the norm of their regular mood. Again, so it's not just your everyday teenage angst. You're seeing like, this is not my kid. This is like totally out of the norm. And then a big one too is changes in their sleep patterns. So again, you're saying, Adeline, that sleep, the decreased need for sleep is, a big one in adults. That's also a big one for children. If you notice that your child is not getting enough sleep, they're not able to fall asleep, they have so much energy that they can't go to sleep. And let's say they only slept an hour, 2 hours over the last week, but they seem to feel, again, very hyper, very full of energy. That is something that, that would be like a red flag, something to pay attention to. And then also just noticing changes in their energy levels. So again, seeing that your kid just seems more like wired, more amped up, more like hyper. I think hyper might be like a good word to kind of describe it, that behavior in children, but they're just more hyper than they usually are. And then followed by the being overly hyper, then you see that like downward, depression where they're, have low energy, low interest. So if you're kind of seeing those shifts and again, it's outside of the norm of their typical behavior, that's something that might, give you a reason to consider whether bipolar might be a condition to look out for.
That sounds like it's a big key. Well, first, I can totally see why it's so hard to diagnose in children and teens. But it seems from what you're saying, Michelle, what I hear is that the big key is something that's not their norm. So as a parent, it's so important to really know your kids and to be familiar with what's normal for them. Like, is it normal for them to sleep 5-6 hours, during the week, and then maybe sleep in on weekends and sleep, 9 hours or so? Or is it not normal for them? Is it normal for them to be pretty hyper and energetic, or is it not normal? So it's like kind of what I'm hearing is that decreased need for sleep, but overall just things that are very distinctly not the norm for them. And so let's get into causes and risk factors. The exact causes of bipolar disorder, they're not fully understood, but Research suggests that it does result from a combination of genetics, biological factors, and also environmental factors. But a few potential causes include genetics. Bipolar disorder, it is more common in people who have a first degree relative with the condition. And much more so than in other conditions, bipolar disorder, we do tend to see a bit more of a stronger genetic connection than what we see in like anxiety or depression. There's also biological differences. And so the research related to this, it seems to be in more of the earlier stages, but there is some research that has shown that there are physical changes in the brains of people diagnosed with bipolar disorder. And the significance of these changes, they're still not very clear, but they may eventually help pinpoint some causes. And so that's, I think, very promising research. And then when it comes to risk factors, like I mentioned earlier, having a first degree relative, such as a parent or a sibling with bipolar disorder, that's a big risk factor. Experiencing periods of high stress, such as the death of a loved one or a traumatic event. What can happen in some people is that they might have a genetic predisposition for developing bipolar disorder, but they don't actually develop it until they've experienced this really severe, traumatic, stressful event. And drug or alcohol abuse, they can exacerbate the symptoms. So they can make symptoms of bipolar disorder worse than they would have been otherwise.
Yeah, so in terms of treatment for bipolar disorder is going to be a lifelong condition, but it can be effectively managed with a combination of treatments. And one of the big ones would be medications. So something you'd want to see a psychiatrist for. So there are different types of medications that have proven to be helpful for bipolar disorder. One of those would be what's called mood stabilizers. So some examples of mood stabilizers would be lithium. There's a medication called Depakote, Tegretol, and also Lamictal. So those are some examples of mood stabilizers that are often used. And then another type of medication that can also be helpful would be antipsychotics. So antipsychotic medications would include ones like Zyprexa, Risperdal, Seroquel, Abilify, Latuda. Those are some examples of antipsychotics that have proven to be helpful. And then doctors may also prescribe an antidepressant to help manage the depression episodes. So we talked about the mania, hypomania, but there's also the depressive episodes that happen. So antidepressants would also be prescribed, but with antidepressants, sometimes they can cause a manic episode. So if it is prescribed, it's usually also prescribed along with a mood stabilizer or an antipsychotic to try to mitigate some of those symptoms. So you might see, like different medications having to be prescribed to help treat this condition.
So kind of to create that kind of perfect balance between managing the mania / hypomania and the depression, sounds like.
Yeah. And I think, and we've mentioned this before in other videos, this is something that it's going to take some trial and error. And so if the first round of medications don't seem to work, don't just stop taking it. Don't feel discouraged. Sometimes it takes a couple of, tweaking of different medications or maybe even tweaking dosages to try to find the right combination. So there is going to be some trial and error, and it's going to take a lot to just make sure you're working with your psychiatrist or your doctor to make sure that, you're finding the right balance, but just never stop taking it or feeling discouraged. Sometimes it just takes a little bit of trial and error.
And if you do have concerns about side effects, so maybe you think, oh, this is really upsetting my stomach and I'm not seeing any improvement in my mood, please speak to the person who prescribed the medications before you suddenly stop taking them, because that can have some very serious effects too. So please just call the person who prescribed them before you do that.
Right, definitely.
So the second treatment is psychotherapy. And so cognitive behavioral therapy, CBT, we will mention this many, many times. We have mentioned it many, many times. It's research-based, it's evidence-based. The focus, just as a reminder, is identifying unhealthy negative beliefs and behaviors and then replacing them with healthy and positive ones. And so CBT, what it can do specifically for bipolar disorder is that it can help you with identifying what tends to trigger your bipolar episodes. Another type of, it's not exactly psychotherapy, but it's called psychoeducation, which is learning about bipolar disorder. So education, of course, is the education part, and psycho refers to anything psychological. And so that can really help you and your loved ones understand the condition, because even though I think all of us have heard of bipolar disorder, like we said at the beginning of the episode, it is one that tends to be not as well understood as, let's say, anxiety or depression. So that can be really helpful. And then the third one is family-focused therapy. And I think with family-focused therapy, it could be psychoeducation, like I mentioned earlier, with the family, and also therapy with your family. Family support and communication can help you with sticking with your treatment plan, and then help you and your loved ones recognize and manage warning signs of mood swings. specifically with bipolar disorder, because I don't think you've really heard us mention family focused therapy too much with the other disorders that we mentioned. It's especially important with bipolar disorder for a lot of reasons. But if you think about the manic and hypomanic episodes that Michelle described earlier, they can really affect your loved ones. If you're married in a relationship, if you're going out spending thousands and thousands of dollars, driving really fast, having multiple sexual partners, like those things, they don't just impact you, they really impact your loved ones too. Another thing is that with bipolar disorder, people don't tend to notice their manic and hypomanic episodes themselves while they're in them. So they might recognize it afterwards. So maybe once they're out of that episode and they're either a bit more stable or maybe more of a depressed episode, they might look back and think, oh, I think I was maybe a bit manic then. But they don't usually recognize it themselves in the moment. It tends to be other people. So you really need to bring your loved ones on board in treatment and have this really open communication where they might tell you, hey, I noticed that you're talking kind of fast. I noticed that you don't seem to be sleeping as much. Have you been taking your medication, or do you think you might be in a manic or hypomanic episode? And so bringing that up to the person in a way that's really sensitive, I think family focused therapy can be really, really helpful for that.
Yeah, I think that's a great example of how, you can't just do this on your own. Having that proper support system, having like your family on board, your loved ones, or, if you're married, your spouse is really important in helping, again, manage the symptoms and making sure that everything is effective and that it could be successful. And then there's also lifestyle changes that can also help. So maintaining a regular sleep schedule, engaging in physical exercise, practicing stress management techniques, all of those things are good for everybody. And especially for someone with bipolar disorder, especially as you can see when we're talking about symptoms, how sleep is a trigger for if something might be going wrong, if someone's not sleeping enough. So having these, good regular patterns and practicing them and being diligent about them is just good for everybody. And especially good if if you are someone who struggles with this condition. And then there's also support groups. So joining a support group can provide a sense of community because, again, we're saying support, having that community support is so important. You're also around people who understand what you're going through, and you can also attain really valuable resources for yourself and as well as for your loved ones in terms of coping. So there's a really great organization, the National Alliance on Mental Illness, NAMI for short, and they have a lot of great supports for loved ones, for people who have loved ones that are caregivers for a family member, friend that has a mental health condition, but support groups for loved ones as well as for someone who is diagnosed with bipolar disorder. Both of those types of support groups are helpful for both sides to help with coping.
Yeah, I give that resource to my patients all the time. NAMI has a lot of local chapters. They have a local chapter here in Jacksonville, and it has a lot of great resources. So for anyone who's curious and wants to go to their website, you can look that up, and there's a lot of great information that they provide.
And I will say, NAMI, their support groups are also free of charge in most cases. I mean, the ones here that I've referred clients to are free. So I think, it's definitely a great resource, and especially to help build that support network that I think is so vital. So bipolar disorder, as you can see, as we're talking about it, it's a complex and challenging condition. However, with proper treatment and support, individuals can, manage their symptoms and lead fulfilling lives. So if you or someone you know is experiencing symptoms of bipolar disorder, it's really essential to talk to a mental health professional. Please don't watch something on TikTok and then assume that you have bipolar disorder and then never confirm that with a mental health professional. This is something that you definitely need a licensed mental health professional to give you a proper diagnosis and then to also work on a proper treatment plan.
And so that's all that we have for today's episode on bipolar disorder. I'm Dr. Adeline Leon, licensed clinical psychologist.
And I'm Michelle Young, licensed clinical social worker. So if you enjoyed our show on bipolar disorder, please make sure to give this video a like and subscribe to our channel so you can get notifications when we upload our weekly episodes. Also, make sure to check out our other episodes on depression, on anxiety, on OCD, ADHD, narcissistic personality disorder. We'll definitely link all of them below, and definitely check them out because we also offer tips and interventions and ways to manage those symptoms as well.
And as always, we'd love to hear from you in the comments. Are there any other mental health disorders that you'd like for us to cover? Like Michelle said, we've already covered quite a few, but we're always open to feedback, and anything that you'd like us to speak about, definitely let us know in the comments.
And thanks so much for tuning in to Mental Health Merienda, your snack-sized guide to mental health wellness. We'll see you soon. Bye.
Bye.